Hello friends, today we are going to discuss the central nervous system disorders with the study tricks and mnemonics. We are seeing now the multiple sclerosis, a degenerative disorder. Before that, if you are not subscribed my channel, please subscribe it and also press the bell icon so that you will get notifications if I am uploading new videos. The all central nervous system disorders that we can be remember with the word vindicate, VINDICATE, that are vascular, inflammatory, neoplastic, degenerative, infectious, congenital, autoimmune disorders, trauma and endocrine disorders. Remember this word vindicate. Okay, let's see this one by one. First one, V is for vascular. Vascular is the problems the circulation to the brain and the spinal cord, mainly the stroke. A stroke is an interruption of the blood supply to the brain. Then we see I. I is for infections. Infections are infection of brain and its covering. The main infectious disease of the central nervous system include meningitis, encephalitis and brain abscess. Now the N is for neoplastic, that are the tumors or brain and spinal cord. Comes to D is for degenerative disorders of the brain that include Alzheimer's, multiple sclerosis and Parkinsonism. Then I for inflammatory, that are inflammatory disease like rheumatoid arthritis may affecting the brain and spinal cord. Then comes to C. C is for congenital disorders, that are aneurysms are the most common congenital disorders. Then A is for allergic and autoimmune disorders. An autoimmune disorder is a condition where the immune system attacks and destroys the healthy body tissues. T is for trauma. Any type of traumatic injury or injury done to the spinal cord can result in a wide spectrum of disabilities. E is for endocrine and metabolic disorders. Now here comes to our topic, that is central nervous system disorders and its signs and symptoms, treatment and nursing interventions. We know for the last exam, that is PSC, Kerala PSC exam, they asked many questions based on critical thinking. As we know, this critical thinking questions may be little bit confused. So a thorough knowledge regarding this topic is very necessary. We can expect some more questions from this multiple sclerosis, because this multiple sclerosis does not having any typical diagnostic test or typical medicines, so that there is a chance to ask such type of questions from this topic. At the end of this video, we can see some more important points regarding this topic, so try to watch this full video. Multiple sclerosis. Multiple sclerosis is a chronic autoimmune disorder which is characterized by the destruction of myelin sheath as well as neurons in the central nervous system. Body's own immune system, that is antibodies, as well as the T cells, destroy the body's own structures. In this case, the antibodies as well as the T cells target the main tissue, mainly the myelin sheath. You know, the myelin sheath gives support and protection, and it improves the speed of conduction through the neuron. These antibodies attack the myelin binding protein. It is an antigen that is found in the myelin sheath. These antibodies are directed mainly against this myelin binding protein. So there will be destruction of the myelin sheath may occur, that is leads to demyelination. In this diagram we can see a healthy neuron with a healthy myelin sheath, and below that there is a damaged myelin due to multiple sclerosis. Damage to this myelin sheath cause loss of neuron, loss of myelin and abnormal nerve conduction. There will be some characteristic features in multiple sclerosis due to that myelin sheath loss.
So these pathological features are inflammation, demyelination and gliosis. As you know, the inflammation is due to the autoimmune disorder. There will be the inflammatory cell infiltrate. So the inflammation may occur. Then this demyelination, and the other feature is gliosis. Gliosis, that is, as you know, the glial cells are supporting cells of brain, that these cells provide support and insulation to this neuron, and these include astrocytes and oligodendrocytes. In multiple sclerosis, our own body system attack this body zone cell. It causes hypertrophy and proliferation of the glial cell. So there will be formation of a scar tissue. That scar tissue we will call it as plaques. These plaques can see in anywhere in our brain. This scar tissue we can see in MRI. The clinical features of this multiple sclerosis is depend on where is this scar tissue formation occur in the brain. The clinical features are sensory. In sensory, there will be paresthesia, hyposthesia, and pain. This pain may occur anywhere in the body. This paresthesia is the tingling and prickling sensation in the body, and hyposthesia, reduced sensation. Vision problems, blurred vision, diplopia, retroorbital pain. Patient may have weakness, stiff muscles, painful joints, tremor, tingling or numbness, that is paresthesia, and trigeminal neuralgia may be present. Some patients may have slurred speech, bladder control problems, dizziness, and later signs there will be mental or physical fatigue, depression, or euphoria. These signs and symptoms are characterized by two different stages, that are relapsing remitting multiple sclerosis and primary progressive multiple sclerosis. In relapsing remitting multiple sclerosis, the attack or exacerbation of the multiple sclerosis is seen, and in primary progressive multiple sclerosis, the signs and symptoms are developed very slowly. Diagnosis. Multiple sclerosis is typically diagnosed based on the presenting signs and symptoms in combination with the supporting medical and imaging laboratory techniques. For multiple sclerosis, there is no identical investigations or tests to carry out to rule out the diagnosis. Investigations are based on the signs and symptoms only. Mainly, we are doing blood test, MRI scan, evoked potential test, lumbar puncture or spinal tap. Evoked potential test. An evoked potential test measures the speed of nerve message along sensory nerves to the brain and sometimes used in the diagnosis of multiple sclerosis. Lumbar puncture and CSF study can identify antibodies that suggest the presence of multiple sclerosis. In contrast, MRI, damaged blood-brain barrier can be seen multiple sclerosis lesion known as DAWSON's fingers. Now we are seeing some patient education before going to evoked potential test, that are performance on an evoked potential test is affected by fatigue. So try to get plenty of rest before we are sending this patient for the test. Wash patient's hair on the night before and don't use any hair product on the day of the test. Patient will need to remove all jewelry. Patient can normally eat and take regular medications before this evoked potential test. Let us see what are the medications that we are administering for this multiple sclerosis. First of all, there is no typical medicine for this multiple sclerosis. We are providing symptomatic treatment only. Beta interferons are given to slow down the process of multiple sclerosis and reduce the number of attacks. Muscle relaxants are given to reduce muscle stiffness and spasm. Another medication is methylphenidate or modafinil. It is a CNS stimulant that may reduce fatigue but may also cause side effect of nervousness, restlessness and insomnia. For the bladder issues, we are administering oxybutynin and
Bethanacol. Bethanacol is a cholinergic that help with emptying the bladder by helping with the bladder contraction.
Then we are seeing the nursing management of multiple sclerosis.
The multiple sclerosis attack may be worsened when there is a chance of heat, increased temperature, stress, fever, and sun exposure. So, the first nursing intervention is to prevent these risk factors.
Avoid sun exposure or stress and protect the patient from infectious environment. Then cool down. The most important factor in this multiple sclerosis is cool environment. We have to give a cool environment, cool bath, cool tub bath or a cool shower bath should be given daily, and avoid the conditions that may rises the body temperatures. Then another problem the patient may having is diplopia. So place an eye patch on the eye for diplopia. Advise the patient to avoid over exercise. It may cause increased fatigue. And encourage the patient to take regular exercise and be sure not to overdo it. The best exercise for this multiple sclerosis patient is swimming. The diet include low fat diet, high fiber food, and food should be high in potassium.
Then we are seeing some patient education regarding multiple sclerosis. Get plenty of rest. Extreme tiredness is a common symptom of multiple sclerosis. So, advise the patient to take plenty of rest. Exercise can done in a moderate range and be sure not to overdo it. Stretching can be useful with medicines to help the symptom of muscle stiffness. Exercise. Aerobic exercise may improve patient's health, muscle tone, balance, and coordination. Avoid excessive heat or sun exposure. Plan the patient activities in advance. In a progressive manner, we have to give the activities of daily living to this patient. Take your medicines exactly as directed your healthcare provider. Don't skip doses. Use hot tubs or long hot bath with caution. If you soak too long in hot water, your muscles may become weak. Don't get in a hot tub unless there is someone nearby who can pull you out if necessary. If you become overheated and your symptoms get worse, cool down for few hours. This will help you to return to normal. Consider installing an air conditioned system in your home if you don't already have.
These are about multiple sclerosis. We have to discuss some more special points on multiple sclerosis, that are gliosis, DAWSON's fingers in MRI, MBP, descending paralysis, evoked potential test, and therapeutic diet of multiple sclerosis. Let us see one by one.
Gliosis. Gliosis is a non-specific reactive change of glial cells. It involves the proliferation or hypertrophy of several different types of glial cells, including astrocytes, microglia, and oligodendrocytes. Dawson's fingers. Dawson fingers are a radiographic feature of demyelination characterized by preventricular demyelinating plaques distributed along the axis of medullary veins. They are a relatively specific sign of multiple sclerosis. Oligoclonal banding. An oligoclonal band is a protein called an immunoglobulin. The presence of oligoclonal bands in CSF suggests the inflammation of the central nervous system due to infection or other disease. The test is also known as CSF oligoclonal banding or CSF immunofixation. Evoked potential test. An evoked potential test measures the speed of nerve message along the sensory nerves to the brain. Visual evoked potential test is the most common test that is used in the diagnosis of multiple sclerosis. Therapeutic diet for multiple sclerosis is it should contain low fat, high fiber, and high level of potassium.
in order to avoid constipation, provide energy, and improves nerve conduction.
A descending type of paralysis. The paralysis is descending type of paralysis that is seen in multiple sclerosis. These are the important points regarding the multiple sclerosis. I hope you got all these points. Watch this video a couple of times. Thank you. Thanks for watching.